According to research data done in 2009, there are approximately 280,000 kids under the age of 18 years old who are treated by a doctor for baseball-related injuries. More specifically, 20% of children 8 to 12 years old and 45% of children 13 to 14 years old will have pain in their arm during a single baseball season. This is most commonly related to their shoulder or their elbow. There are several reasons for the development of injuries in the arm in young baseball players. One is overtraining. It basically means that their coaches are pushing them, or they're pushing themselves too hard in terms of preparing to play baseball. Second, even more important problem is the use of poor techniques. Unfortunately, many baseball players do not learn the proper throwing techniques, and without the proper technique, you can really put a lot of stress across your shoulder and elbow that can place you at a higher risk for injury. And another reason is that many kids will try to play on multiple teams during one season, or they'll try to play on multiple teams that extend their season almost year-round. And the combination of playing on more than one team or playing year-round without resting really puts a lot of stress across the arm and shoulder and causes an increased risk for injury. There are several steps that parents can take with their kids who are playing baseball, and coaches can use as well to help alleviate or avoid these injuries. One is that if a player starts to experience pain, they should stop playing until they're examined by a doctor and cleared to go back to play. Many times children will try to play through the pain, and this will often make an established injury worse or lead to another injury. The second important thing is to make sure that kids are learning proper techniques in terms of throwing, and this is especially important for pitching. There is a specific technique that pitchers should use in terms of their mechanics, using their core body strength, their shoulder, their elbow, their entire upper extremity. And if children are just placed on a mound and told to play, this can put too much stress on their shoulder, and if they're using the improper technique, this can lead to injury. Part of using the proper technique is also using the proper strengthening and stretching techniques, and these should be used not only to warm up before play, but also to cool down after play. And the final step is really to rest, and that a player should avoid playing on consecutive days. Pitchers should not pitch on consecutive days. They should avoid playing on multiple teams and year-round, and they should follow the rules regarding pitch count guidelines. Good resources for additional information are the American Academy of Orthopaedic Surgeons, as well as the Stop Sports Injuries campaign, which you can go to at www.stopsportsinjuries.org.